Good morning. Am I audible? Good morning to all. Am I audible? Great. Good morning to all. So we are starting our reading club with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning all. We are giving tribute to a great master, Dr. Samuel Hahnemann, for this wonderful divine science as a gift to all of us. We are seeking blessings from our Guru, Dr. Prafull Vijayakar sir, who have reached this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijay Karaya. Friends, we are in the journey of understanding and reading the wisdom of Dr. Samuel Hahnemann from Organon of Medicine, the Sixth Edition. So up till now, we have understood that the disease of local disease and disease of one-sidedness, how to deal with it. So Master Hahnemann is telling us in this regarding that whenever the local disease is externally manifested, do not treat by topical means. So in further continuation of this, the mere topical employment of the medicines that are powerful for the cure when given internally to the local symptoms of the chronic miasmatic disease. is for the same reason quite inadmissible. For if the local affections of the chronic disease be only removed locally and in one-sided manner, the internal treatment indispensable for the complete restoration of the health remain in a dubious obscurity. The chief symptoms, the local affections, is gone, and there remains only the other less distinguishable symptoms, which are less often and less persistent than the local affection, and frequently not sufficiently peculiar and too slightly characteristic to display after that a picture of the disease in a clear and peculiar outline. So as we all know that in one-sided disease, there is already there is a paucity of the symptoms, and if the symptoms are less, and on the basis of that less symptoms, we have to prescribe. So the first method, Dr. Hahnemann was advised that when you find a symptom, you prescribe the medicine. It may be partial. Then again, you find another symptom, another way, another medicine that gives a cure has been started. Then he said that sometimes you find that this paucity of the symptoms are very, very characteristic in appearance, and that if you apply that characteristic, then you prescribe the GCS or a constitutional remedy, and you will get the result. Then also he applied that do not apply to treat the local disease with the topical employment of the medicines because it is inadmissible, quite inadmissible. Why? Because you know that if we remove that topical or external disease, then the perceptible sign and symptoms of the internal derangement, which is expressed outwardly in the form of local disease, is destroyed by this local malady or local treatments or topical treatments. Then we cannot get the PQRS symptoms of the patient, and then the disease of internal origin we cannot restore in a proper manner. That's why the Master Hahnemann is telling us that do not apply this into practice. Then further he said that if the remedy perfectly homeopathic to the disease had not yet been discovered, that means the partial symbolism at the time when the local symptoms were destroyed by a corrosive or a desiccative external remedy or by a knife, then the case becomes much more difficult on account of the too indefinite and inconstant appearance of the remaining symptoms for what might have been contributed most to the selections of the most suitable remedy and its internal employment until the disease should have been completely eliminated, namely the external principal symptom has been removed from our observation. So this is what again one reason he said that if we do not find a right homeopathic medicine specifically in local disease and the local disease is destroyed by the different methods like cauterizations, desiccations, or surgical removals and everything, then everything's become very, very difficult to treat because the definite symptoms of that particular thing has to be. That's why we are in treating the disease, and Dr. Vijayakar sir advised that we have to take into considerations of the JOD, journey of the disease. So in JOD, you can find out how the disease travels from one layer to another layer to another layer, and how the disease travels from miasmatically. So that will help us to find out. But during the time of Hahnemann says that if the local symptom has been removed, then it is very difficult to find out the exact observations which is missed when the local symptoms has been destroyed. So this was the things which is happened during the time of Hahnemann that as was the case before my time with the remedies for the condylomata disease and they remove the condylomata with the cauterization and what Hahnemann wanted that the remedy to be prescribed as an antisoric or a constitutional remedy to remove this. Had it still been present to guide the internal treatment, the homeopathic remedy for the whole disease might have been discovered, and had that been found, the persistence of the local affections during its internal employment would have shown that the cure was not yet completed, but where it cured on its seat, this would be a convincing proof that the disease was completely eradicated and the desired recovery from the entire disease was fully accomplished. And an inestimable, indispensable advantage to reach perfecture. So this is what very important when we find out the internal medicines to deal with this local disease, and when you apply that internal medicine, not the external one, and you apply, and the local disease has been gradually going away, and that is the proof that your disease is completely eradicated and desire recovery is ensured. So that is what Master Hahnemann is telling us. In aphorism number 201, it is evident that the man's vital force, when encumbered with the chronic disease, which it is unable to overcome by its own power, instinctively adopt the plan of developing a local melody on some external plan part solely for this object, that by making and keeping in a disease state this part which is not indispensable to the human life, it may thereby silence the internal disease which otherwise threaten to destroy the vital organ and to deprive the patients of life, and that it may thereby, so to speak, transfer the internal disease to the vicarious local affections, and as it were through it thither. The presence of the local affections thus silences for a time the internal diseases, though without being able to either cure it or diminish it materially. However, the local affection is never anything else than a part of the general disease, but a part of it increased all in one direction by an organic vital force and transferred to a less dangerous external part of the body in order to allay the internal ailment. But, as has been said, by this local symptoms that silence the internal disease, so far from anything being gained by the vital force toward the diminishing or curing this whole malady, the internal disease. On the contrary, continue in spite of it gradually to increase, and nature is constrained to enlarge and aggravate the local symptoms always more and more, in order that it may still suffice as a substitute for the increased internal disease and may still keep it under. For example, the old ulcers on the leg get worse as long as the internal psora is uncured. The chancre enlarges as long as the internal syphilis remains uncured, and the fibroids increases and grow while the psychosis is not cured, whereby the latter is rendered more and more difficult to cure, just as the general internal disease continues to increase as time goes on. So this is what very important understanding what Master Hahnemann is telling us, that vital force is so much so intelligent that whenever there is an internal derangement of the vital force, the conceptual dynamic affecting the whole tenor of the systems of the human, and then what happens? The system is taking place to develop a local disease, particularly in the lower part, which is not threatening to the life of the patients, and then this lower part becomes increasing to such an extent, so that this is what very important what Dr. Vijayakar sir is saying. In order to save the whole, body is trying to sacrifice the lowest part of body, or what we call as the least important part of the body, to save the whole. So that is what the vital force is taking place, and that is why they develop a local symptoms or local disease on an external part. So this is very important for our understanding, that when the local part getting increasing, that means this is what we have to understand, that the disease has been there internally and which is uncured. That's why we have to take care of it. So the three process we have to take care of. If the disease of irritation is there on the body, that means the sora is lurking inside. If the disease of the growth on the body or external part, that means the psychosis lurking in the body, or if the disease of the destructive origin is on the external part and getting worsening or increasing, then we have to understand the syphilis is there on inside. So we have to direct our treatment to that particular miasmatic approach, and then we have to treat it judiciously. So this is what very important understanding of it. But what old school do? So in footnote number, Master Hanuman has tell us that the issue of the old school practitioner to do something similar, as artificial ulcers on the external part, they silence some internal chronic disease, but only for a very short time. as long as they cause a painful irritations to which the sick organism is not used without being able to cure them. But on the other hand, they weaken and destroy the general health much more than is done by most of the metastasis affected by the instinctive vital force. So that is what also old school practitioner right now we have to understand the conventional treatment also help doing like this. So whenever they suppress a certain things to certain area or a local manifestation, then what the vital force is doing, vital force is started doing metastasis to the different process, and that is what Master Hanuman is telling about the suppression here. The same thing what Dr. Vijayakar sir has told about when you remove the external things by means of separation, and then this separation goes to the other organs and it is metastasized because our vital force is very intelligent and to deal with, and when you close one door to express their phenomena, it will transfer to another door and express in the higher versions or higher layers. So this is what the wisdom of Dr. Samuel Hahnemann telling us that what to do in these cases. So in 2002, the old school physician should now destroy the local symptoms by topical applications of the external remedies under the belief that thereby cure the whole disease. And nature makes up for its loss by rousing the internal melody and other symptoms that previously existed in a latent state, side by side with the local affections. That is to say, she increased the internal disease. When this occurs, it is usual to say, though incorrectly, that the local affection has been driven back into system or upon the nerve by the external remedy. So that is what very important, that whenever the chicken pox or whenever the measles are there and the local applications of the acyclovir and everything was given, and then they develop symptoms. This symptoms has been destroyed and the latent state is increasing the things and is destroyed to the deeper layer into our nerves. That means the ectoderm to the neuroectoderm, and then this is what we called as the disease has been suppressed and transferred into it. So in aphorism number 203, what Master Hahnemann is telling that every external treatment of such local symptoms, the object of which is to remove them from the surface of the body, whilst the internal miasmatic disease is left uncured, is, for instance, driving of the skin, sodic eruptions by all sort of the ointment, burning away the chancre by the cosmetics, and destroying the condylomata on their seat by a knife or ligatures or the actual cautery. This pernicious external mode of treatment, hitherto so universally practiced, has been the most prolific source of all the innumerable named or unnamed chronic maladies under which mankind groans. It is one of the most criminal procedures the medical world can be guilty of, and yet has hitherto been the one generally adopted and taught from the professional chair as the only one. So this is what Master Hahnemann is telling about, that this treatment of the local affections is treated by means of destroying by the ointments or the cauterizations or the ligatures or the surgical means, and it was also taught from the professional chair that this is the only and only treatment, but it is nothing but it is which increasing the internal malady of a different names, and then it is what Master Nehmer is telling, that this is the criminal procedure medical world can be guilty of. So this is what understanding of do not remove the action, because this external part is trying to give you a clue that you have to treat the internal malady. So this is what the few wisdom of our master Kahneman to understand the local disease or the disease which have a paucity of the symptoms. When we have the paucity of the symptoms, we have to deal with this. So do not destroy it with the local treatment. You have to treat judiciously and rationally. As we know, we are reading the continuations of the Genetic Materia Medica by Dr. Prafull Vijayakar, sir. So up till now in this book, we have covered the many groups from the Parata group, Calcaria group, then Kali group, and the carbon groups. And today we are reading the last few pages of these books. So in this, we have two different remedy we are dealing with. So we are reading with granite and marbles. So, how the granite persons present to you in your clinic and how you have to treat the patients very beautifully. So, to understand that, we have understood calcarea by means of the chalk, and we have understood the carbon by means of the charcoal. But when we have to understand the granite, we have to understand the granite marble. So this is what you have to understand. So this remedy, granite, is available in the name of lab GRM or granite, often confused with the granatum. So granatum is a vegetable substance which is called prepared from what we call as pomegranate. But do not confuse it. This is a mineral, a granite. Its name is lapis GRM. When ordering from the pharmacy, one need to be very careful because granitum is the often supply instead of granitum. So this is very important. So granite is called as hardened silica. So when the silica becomes so much so hard, it become a granite. So chemical composition. So anything we have to understand the source, and then that source has to be applied to our practice so that we can understand the remedy and its dispositions in a proper way. So the granite is a hardened silica, and the chemical compositions consist of following things. So the worldwide average of the average proportions of the different chemical component in the granites in describing descending order. So silicon dioxide is 72%, aluminum dioxide trioxide 14%, potassium oxide, sodium oxide, calcium oxide, iron oxides, iron dioxides, magnesium oxide, titanium oxides, and manganese. So these are the few percentage. So it is more of a combinations of the silica, alumina, and potassium, sodium, and calcium. So this is what the combinations of all these things into it. So granite is a rock found both from the superficial to the deepest layer of the earth. So if we go to the mountains, we see many rocks around, but we never wonder what the rock must have undergone lying there for the centuries. The rock is stable, so stable that nothing except a huge crane can move it. In the late 50s, two famous cricketers, one from the India, Vijay Manjrekar, and another from England, King Barrington, had earned the nickname of the Rock of Gibraltar. So Rock of Gibraltar is a name given to at this. This signifies their game and temperament in the field when they were at the creases. No ball, howsoever quick or a shrewdly turning, ever got through their strong, unprintable defenses. So this is what was. No bouncer affected them. They went on and on, even if the batsman on the other side failed to score. They were sticking to where they were, unmoved by fear, anticipation, etc. So this is what very important understanding that this rock is something like this. They were sticking where they were, unmoved by fear and no fear and no anticipation. This is how rock is. It is fixed, does not move, cannot be moved, and passively, unemotionally watch things happen in nature, and that too for the centuries. So this is what you have to understand the dispositions of the person is. So rock may have been a witness to many bloody wars, many floods and deluges, many famines. So thousands may have prospered around them, thousands may have suffered around them, but they are not moved. So this is what very important understanding that how this person is. So this is exact pictures on which I prescribe the granite. So this is what first clinical experience that it may be imaginative and hypothetically. but it works. So this is what Sir's understanding that how this source represent the personality. So it works brilliantly and has been given in cures in the cases ranging from the diabetes to the retinal detachment or with the cancer. So this was the things that Dr. Vijayakar sir has used in these cases. So the granite personality is very, very indolent, haughty, introverted, never communicate, and very, very unemotional, not moved by any emotion. This is very important understanding, and the only emotions that is exist is the anger. So they are very, very angry. It is perfectly the psychotic excess or the hyperpsychosis causes synthesis of the extra fibrin that makes them tough and their parts become so much so hard. They are hard-hearted, cruel, unorthodox, dominating, and dictatorial kind of personality. So, to understand these things, this is what the personality is. So, they are haughty, introverted, and indolent and unemotional. So, when we think of haughty, introverted, indolent, and unemotional, we can think of haughty and introverted personality like the China, like the Platina, like the Epica. These are the haughty and introverted. Same way, the granite is one of the remedy. So when the persons become haughty, their perception goes to the delusion better than others, and he is deserted and forsaken, detached, or perceptions of the superiority. And if the person is very, very unemotional and not moved by any emotions, then the persons become indifferent, apathy to relationship or even to the family. So this is what the things you have to keep in your mind. And if the person's having only and only one emotion, that is anger, so that represent in the form of irritability or from the carelessness of the others about causelessness differs from anger easily. So this is what you have to understand. Irritability differs from anger easily. So this is what the granite personality is. So the case what Dr. Vijayakar sir has cured is. So a couple of cases may help us to understand it better. So this was the case of the retinal detachment and the threatened blindness in the right eye that was cured 15 years back and can cure even today. The 60 years old gentleman came in with his wife and was seated very erect in the chair without a smile on the face. The pupil of his left eye was white as marble, for which he blamed the surgeon who, according to him, had spoiled the case. His speech was fast, rough, and had no voice modulations. There were no signs of any emotions on his face. It seemed as if we were dealing with a robot who never permitted his wife to say a single word. This is very important. She sat there as a silent spectator. During the 45 minutes interview, he never moved, giving an image of an immovable, inanimate object kept in front of eye. It was clear by now that the wife was forced to accompany him because of his threatened blindness, otherwise, she did not seem to have any role to play in his life. When asked about his nature, he quipped, "My nature is very near to the nature. I am very open and frank person. People do not like this way in today's world. My family member thinks I am too blunt. My frankness hurts them. Of course, I don't care." So this is what the word can give, that this is the personality is very, very insolent, impertinent, the rudeness and answer snappishly. So you may he may be a platina, he may be a Naxwamika, he may be a chamomilla type of personality. I have one daughter and one son. So my son has left me because he did not like my nature. So now we are only three of us. I don't like word, love, and affections. But they are all useless words devised by the poet who literally do not understand the meaning of life. They feel this world is run by emotions. This sweeping, hugging, kissing are escapist attitude of the weaklings when they do not understand how to manage the maneuver their life. They try to deceive others by their fears and love, taking them away from the reality of the life. Life goes on because it has to go on, because the moon has to go round and the earth has to go round and the sun. So you are born on this and you have to die one day. That is how it is programmed, and that is the reality of life. So this is what the how the person is dealing with and how the blunt behavior of that person. When he was asked, don't you feel such a life is monotonous for you? Don't you feel like seeing a movie or going in for some amusement like music, etc.? So what he says, music is a waste of time. If I were a president of India, I would ban all music players and musical instruments. First of all, I would ban all religious processions and the marriage barracks. People waste valuable time in this dancing and singing. So, so ask another question. How many friends do you have? So this attitude is called as censorious criticals, reproaches others, and quarrelsome and scolding kind of personality. So, Saras, how many friends do you have? So people say that people nowadays do not like frankness. If I show them their mistakes, they will feel I am bad. I know now that I am fortunate to have understood life partner than others. Therefore, I have to correct others which people don't like. When his daughter so this was something that he don't have any emotions, he don't have any sympathy for others, so he becomes so much so unsympathetic, unscrupulous friends and family, even towards the closest. So even towards the closest they are very very unsympathetic. So when his daughter, who was about 33 years of the age, selected for herself a boy to get settled in life, she came and gave a good news to her father. The father got up, went to the cupboard, took out the bundle of notes, and came and gave it to her. This is 25,000 rupees. Take this and go get married. This dry reactions really hurt the daughter as well as his wife. When he was asked about his behavior, he said, "What is there to enjoy about it in it? Everyone get married. What is new about it? Why should one celebrate? Do the animals celebrate their marriage? What is the great deal? I gave her money so that it will help her to start a new married life. That's all." So even though there is no happiness, no anything, no emotion, this is what something or blunt. So the above case highlights the characteristic of the granites, that it shows how granite people is very very harsh, hard-hearted, haughty, unsympathetic, unscrupulous, indifferent, unemotional, and unfriendly. So the reason I always mention this case is because it taught me the pictures of the granite. When I saw this man, I got the feeling that he was unmoved, and then when I looked through the rubric of granite, I saw that everything was covered. That's why I would like others to learn from it through the later many cases responded to the granite giving success. One sentence that sums up the grenade is that nothing moves and everything is hard. He is never moved to tears or joy by anything. Even the bowels do not move. There is a severe constipation with the hard stool. The only emotion display is that of the anger. So this is what very important understanding of the grenade is. Now, general is thermally more or less the hot people. Thirst is good enough, though not very marked to be called thirsty. Physical attribute. This is one remedy for hardness or the swelling of the glands like the calcarea floor, barata mur, conium, or even tarantula cubensis. A case of the cancer of the liver that responded well had growth that was palpable as a hard stone. So this is what the granite is. The case of cancer with the hard stone responded with the granite. So genetic miasmatic reflections of the granites. So the predominant miasm looks like a psychosis, but this miasm is so intense that intensity of all psychotic trend is in excess, and therefore the miasm goes into syphilis. So excess fibrin synthesis makes all part and pathology hard as a stone, the excess hardness, etc. It is seen in the behavior, emotions, and the reactions. The excess hardness in the behavior lead to the abrupt behavior, rock-like and robot-like behavior. So when you find the behavior rock-like, robot-like with the hardness, no emotions, you can think of it is a granite. So excess hardness causes indifference and apathy to the family and friends too, and extend to the heartlessness. So hardness causes this heartlessness. So reaction to anything is hard, so much so that he gets detached and has lack of moral affection. So hard reactions and lack of moral affection. So when we combine with this granite and the marble, these are the two different remedies, the granites and the marbles. So granite has the ego represent in the form of haughtiness, contemptuous, reproaches others, rock solid, immovable, dominating, and dictatorial. So one fine day you find the pictures of platinum. The lapis marble is also egoistic. The perception goes that he is the king. So king has everything in the power. Money and the emotions, though the granite is very indifferent to the any emotions, money, status, relations, no emotion except the only anger. Whereas lapis marble having a desire more riches or luxury at the cost of other and average. So this is what lapis marble is very average personality. Stability, so granite has more stable, whereas lapis marble is capricious. So when you find out the marble can break. The granite is so hard and tough, it is very difficult to break it. Okay. So same way you can understand in this manner also. Introverted and extroverted both are introverted, but sometimes the lapis marble is communicative, expansive. There is no anticipation in granite. There is anticipation in the marbles. There is a charesis. The granite hates charesis, whereas marble likes charesis. Miasm, more of a psychosyphilitic. Marble has a psychotic. So this is what a difference between these two. And up till now, we have learned the whole book. So in that book, we have learned that. The remedy of a right-sided and yet the timid people. So we compare this with this chart and that will help you to differentiate the four group of remedy very easily when the patient comes to you in your clinic with the right-sided affections and the person is not so much so timid. So the comparative study through this. So the right-sided and yet timid people. We know the right-sided peoples, right-sided affection peoples are dominated by the left brain, and the left brain is responsible for the strong analytical personality. So whenever you find that the right-sided affections with the timid personality, you can think of this four group of remedy. This is four group of remedy. Then the different salt has to be applied into your practice. So the speed of that four group, so we can see that the Varita is slow, Calcarea is slow, Kali is fast, and Carbon is slow. So if the right-sided and timid people with the fast, you can directly think of Kali. Slow, you can think of Varita, Calcarea, and Carbon. Then you have to understand the disposition extroverted or introverted. So Varita can be introverted, extroverted, Calcarea extroverted except Calcarea mu, which is introverted. Kalis, we know all Kalis are extroverted. Kali Mur and Kali False are introverted and Carbons are introverted. So if we find out the right-sided timid and introverted peoples, we can think of the Baraita, Carbons, Kali Mur, Kali False, Calcarea Mu. So this is what that's why how you have to approach and then you prescribe. Then we have to differentiate with the will. So when we think of will, the right-sided timid people with the weak will, the Baraita, Telkeria also have a weak will, and timid Kalis have anxiety, and startling also having a weak will. Carbons have a physical anxiety, specifically the anxiety related to the carbonate in the chest, petroleum into the stomach, and graphite with the weak will. So this is what you have to observe. The intellect As we all know, the Bharata is very, very poor intellectual remedy or misplaced intelligence. Where to apply the intelligence, Bharata cannot understand. Calcaria has intelligence, but the mathematics is inaptitude for. Kali has slowness and sluggishness of the thinking can lead to the confusion. And carbons are very, very intelligent. So when carbons are intelligent, they go into a development of the sarcastic remark. So this is what you have to observe. The right-sided timid personality with intelligence and sarcasm, you can think of carbons, slow personality and introverted. Sensitivity, the sensitivity lead to all this is the Baraita is non-sensitive because they cannot understand the priority and gravity. That's why the Baraita is non-sensitive. But Baraita has sensitivity of what we call the sensitive to laughed at, mocked at, or sensitive to the criticism. Calcaria is the most sensitive personality that is sensitive to rudeness, sensitive to horrible stories, sensitive to mental exhaustion, so sensitive to everything, criticism. Even Kali is very, very physically sensitive, oversensitive, sensitive to touch. So the ticklishness is there in the Kali, so they are sensitive to very touch. And on touch, they started easily, jerking easily, and easy excitability. So if we have a right-sided personality with the ticklishness, sensitive to touch, and fast and extroverted personality, we can think of it is a Kali. Carbon, as we know, the carbon is a slow, slumbering and lingering complaint. So their sensitivity has gone destroyed to such an extent they are non-sensitive, except the petroleum and the graphite is both are sensitive. Sensitive petroleum is sensitive to smell of the flowers. Graphite is left-sided, that's why sensitive. Emotional reactions, as we all know, the Baraita is emotional reactions is always misplaced. Calcaria emotional reactions are more anxious and anticipatory in Sora, and in psychosis there is more insecurity and the fear. Kali's emotional reaction goes, anxiety goes into quarrelsomeness, and the carbon goes into a different way. The graphite is goes into a weeping and sad disposition, the melancholic, whereas the petroleum goes into quarrelsome. And if the petroleum affected at the higher version, then there is a confusion and the perception has been changed. So that was the emotional reaction. We all know the attachments, even the Baraita does not have the attachment in the proper sense. So old people come with the mother and father, they attach to the father and holding the hand of the mother, even in old people or aged ones or adult. So that means a misplaced attachment, whereas the attachment of the Calcaria to the family, money, and religions, because the Calcaria want the security, the first security they want from the family. That's why they attach to the family. Then they evolve to such an extent that the money is the sole things that will save him. So they attach to the money, so they are more money minded. And after getting a lot of money, they feels that I have to be in the secure hand, so that they goes to the God, Guru, and everyone. So they become so much so religious. This is what Calcaria is. Kali people, all Kalis are very, very selfish. So they are selfish and attachment to oneself only. And the carbons, as we all know, the carbon is the money-minded remedy, right-sided remedy. So money is one of their attachment. Stability, as we know, the Baraita is stable, Calcaria is stable, Kali is very, very unstable, and carbon is stable. So that means the slowness of the pathology can give rise to like this of stability. Now you have to understand the conscientiousness. So all the Baraitas are very, very conscientious and diligent kind, whereas Calcaria, Kali, and carbons are non-diligent, non-conscientious. And the syphilitic pictures. So syphilitic pictures, you can think of the uh, Baraita can go into imbecility. That means the intellect has been gone to destroy, or they go on into indiscretions. This is the lack of circumstance gone to destructions of the intellect. So this is what Baraita. Calcaria. So Calcaria becomes so much so effeminate. That was the syphilitic pictures. whereas the Kali goes into sorosyphilitic state or a syphilitic state, so they become spasmodic, they become panic because of lots of anxiety in the soric state, or finally Kali may land into aversion and indifferent to the family also. That is a syphilitic picture. So there is a restlessness. Kali in syphilis goes into weakness, innervations, and the fatigue because of excess of energy has been used in the previous excitement. So after that, they go into weakness. Whereas carbons having the mannish habit of the women and the girls. So you can think of that is the carbon in mannish, calcarea in effeminates, and creosote in the decay and the putridity. So this is what, in short, the four group of a remedy of a right-sided and timid people, and having that a different will, intellect, moral attachment, sensitivity, and emotional reactions, and the syphilitic pictures. Hope you all enjoy reading this book. So this is what the end of this book. We have completed the genetic materia medica today, and with your continuous learnings and continuous presence in morning sessions help me to uh, learn myself as well as all of you. So thank you so much for making me learn with together. So together we can evolve. We have 10 minutes. So if you have any questions, we will have a little bit of question answer so that we can have a little chat. Thank you for being with me in this journey of Readers Club so that we can read. Up till now, we have read 6, 7 book from the Vijayakar sir's bookshelf. We have another book in coming days. So we'll start with the dispositional book, that is a frequent encounter. I will share the new link and a new what do you call the timing of that book reading. So thank you so much. What was the conflict of gynecomastia? See, most of time the gynecomastia happen in the young male people, and you have to understand that what was the reason behind gynecomastia. Many a time the obese people having look like a gynecomastia because of the excess of fat depositions in the particularly chest area, or sometimes that gynecomastia is because of some of the hypogonadisms or because of some hormonal changes. So according to cause, you have to find out the gynecomastia that develop in that patient because of reason. Now, first and foremost things you have to understand that what is the reason to have a development of the gynecomastia in the male. So male have to have a supportive phenomena rather than the nutritive phenomena. So if the male having a nutritive phenomena, that means that he was going towards the what we call as the masculine, going towards the feminine. That means there is a confusion of their identity. Yes, yes. Confusion of identity. So this is what something you have to understand, that confusion of identity is one of the phenomena can lead to the gynecomastia, because by looking at the person you can feel that he is not male like, he is a female like. So that is what one point of view you can think of, it is a gynecomastia. Sometimes it is abuse in childhood can lead to gynecomastia, because that as a male, I am a weak and I cannot defend, so I have to become a female. That is what one of the things you have to think in this. Again, one point rightly said by Dr. Nisha, that the breast is there to develop. That means to provide a nutrition to the other. Actually, the feminine mammary glands, when the mammals is evolved, how memory glands is developed and how it is evolved. When the mammals has been evolved from the reptiles, or evolution theory, when we think of that in evolutionary theory, uh, life started from the Big Bang to the Earth, and Earth to the what we call as water, then the fish, then reptiles, and then what we call as the mammals. So when mammals evolve, the emotion has been started, and that emotion is started for particularly children's and the family, and to nurture the child and the family. And that's why the things has been developed, and that is called as a mammary gland. So mammary gland is evolved for the purpose of giving a nutrition for others. So whenever there is a breast process, even in conflict also, it is not related to the self. So breast is for the others. So there must be some insecurity about others. There must be some nutrition to the others. There must be some care to the others. And there is worry towards for the others can lead to the development of the mammary gland issue. So that is what we can think of because it is evolutionary. This mammary gland is not for the self. It is self means the persons, but not it is for the children, it is for the families, it is for the others. That is what the mammary gland is. So the gynecomastia is one of the things you can think of. It is a confusion of identity, one of the things, and you can think it is a nutritive, so that you have to find out what was the things insecurity about that. What is the difference between the rubric delirium pain with and the delirium pain from? I think in both there the remedy maybe is same. Look at I will see the rubric and remedy so that we can. Okay, so in this I will share. You can see this delirium pain with the pain and delirium pain from. So Veritramalb is one of the remedies that can cover the both. The rest of other remedies are the different in these things. So from pain means that the pain has been started first, then pain goes into so much so exaggerations, and out of that exaggerations, the patient goes into a state of a delirium or out of control reactions. That is pain from. So pain is first things, but many a time I have not used this rubric in my cases. Most of time, this you have to use this into a cases of the hypertensive headache when the patient having a hypertensive headache and they goes into a state of out of control reaction. Then you can take this rubric. But still now I have not used this both rubric in my practice, so that I cannot share much about that. But delirium pain from this is a pain started first, and then they goes into out of control into form of delirious, and delirium pain with the pain with pain with the delirium. So whenever you find two breakage of the rubric, you go to search to the something what we called as search in the book, which we called as herring guiding symptoms. So when you read herring guiding symptoms, in having adding symptoms, you find the particular things that they have given the whole situations or scenario that how the pain started, and after that the patient goes into mad and crazy things, and that is what they have put the word delirium pain from for delirium pain after this. So that is what I understood from this only, but I cannot differentiate it clinically in this both rubric. If the RA patient is taking treatment from the rheumatologist and is already on the tapering dose of the steroids and the immunomodulator, then if we start homeopathic treatment, then how we will come to know improvement as patient is on a tapering dose. So later also for many days they feel better, and with all this sir, immunomodulators also how we can stop as RA patient will not tolerate this until we get the right simulum, as there are no other symptoms on the basis of which we can know about the whole part. Okay. See, first and foremost things, what Master Hahnemann has advised in the treatment in aphorism number 95, whenever you are treating the chronic disease and the patient is on some allopathic medicines, so you must have to do two things: that to get the original picture of the patient, that you must have to give a few medicines which is non-medicated, that is a placebo, and advise the patient to take less dose or reduce the doses of existing medicines and come after 1 week so that I can get the pure picture of the patient. But practically, it is impossible that the patient will not come due to the pain is there. This is what Master Hahnemann was advised. But many a time, whenever you are dealing with this is the autoimmune patients, and in autoimmune patients, they are giving the immunosuppressive drugs or immunomod. They said it is an immunomodulator, but actually it is an immunosuppressive drugs. And due to that immunosuppressions, they suppresses the inflammatory process. That means the psoric process. When you suppress the psoric process, it may end up with the psychosis or a syphilitic process in the body. So, for this, you need to take the whole history from the patients, and on the basis of that, you have to prescribe the remedy. And in that case, you can do markers for that. So, in a follow-up, you have to see that the RA, NTCCP in the follow-up, and in RA and NTCCP, even allopathic medicine does not reverse the NTCCP, whereas our homeopathic medicines can reverse the NTCCP. So that when you have follow up with the good, your remedy is right and you have prescribed and the patient has been subsiding from the syphilitic destructive pain to the psychotic dull pain, and then sometimes the patient having a pain comes and goes. That means the psoric pain. So at that time, you need to advise the NTCCP, and if NTCCP get reduced to normal, then you advise the patient stop your immunomodulator so that they can understand you, and then you can get. So this is what you have to take into consideration in RA patients. Many a time RA patient has to treat it with the difficulty because in additionally RA patient comes to you after a long standing treatment of the allopathic medicament. No RA patients, initial RA patient comes to you in your homeopathic practice because they are tired of, or what we call as despair, in a state that since we are taking the 5 years or 10 years with medicine and we are not getting results. So at that time they seek another treatment as a conventional treatment for the RA. And at that time you have to do like this gradually. Even rheumatologists of nowadays, the rheumatologists also reduce the doses to such an extent that if the patient does not require a remedy, then they taper gradually, because the sole aim of treatment of a rheumatologist is to improve the life of the RA patients, and that is what they are doing. They are not what we call as treating as a cure, but they are just as to giving a good life to the patient and survive with the betterment so that they can treat in immunomodulations. So that is what we have to do in these cases. But we have to go with the report so that report will tell us how to guide our treatment. And first and foremost thing, we have to improve our confidence to treat this type of patients, because if we have a lack of confidence, then we are confused what to do and what not to do. So go for the search for the right remedy. That is what your part of a treatment, and then rest, put everything to the God will take care of everything. So one fine day I have read somewhere in one of the old doctor's clinic outside, there was one phrase was written, that is, I treat, he cures. So you have to treat the patients and the God will take care of everything. So that is what I personally believe in this type of cases. Hope you got the things, and hope you got the answer of these things. So thank you so much. There is a rubric pain. There is a rubric in one repertory. There is a myalgia, but you cannot take myalgia as the entry point. Don't take fibromyalgia in any patient rubrics. You have to treat the patient as a whole. So thank you so much. We conclude the day today. Oh yes, there is one question. Is the dandruff soric? If the increase after remedy, then is one of the good signs. Yes, dandruff is a soric one. Advise the patient to clean the head every alternate day. If the patient is not worried about that things. Okay. And whenever the patient comes to you with the dandruff and they are worried, that means there is anxiety. That is always a soric. So when psychosis is converted into sora, they started with complaining more and more. Sir, अभी कुछ नहीं करो मेरे को ये डेंड्रफ ठीक करो. Yes, जाता ही नहीं सर बहुत खुजली आती है ये हो रहा है ये हो रहा है. So you have to understand that now patient is started from psychosis to sora. So that when sora in sora the patient is always complaining, irritating you, complaining you, and the doctor is fed of that. Now what to do? But it is what we called as a reversal of the sign and symptom. So you have to counsel the patient. You have a great deal of what we called as applications of the placebo in a different medicine, different way also. Then you have the result. So that is very important. So most of time the remedy is SL in this case and SL in a different format. Water dose, packet dose, globules, one dose, DD, TDS. So that you will get that the patient is feeling that okay, I am having this good remedy for my dandruff. Okay. So thank you so much. Thank you all. Will yeah, you can give any size. That's great. So thank you for being in a journey of reading with me, and we will continue this journey after a few days. So we'll share the details in a group. Till now, what you have learned from this reading club and what you have applied in your practice, please do share your cases in group so that other can learn from all of you. So thank you so much. A big thank you to all, and your presence will motivate me to do this readers club for all of you. So thank you so much. Thank you all.